Well, howdy, DNA. Kate Wilson here with another episode of All Access DNA. In today's episode, we are talking to Barry Tong, he, him, about personalized risk for cancer and how providers assess for cancer risk. We discuss the complexities of cancer genetics, emphasizing the intersection of genetic factors and public health. And Barry explains how cancer arises from both inherited predispositions and environmental influences. I've known Barry since we both lived and worked in Texas years ago in the area of cancer genetics. He is currently a genetic counselor supervisor at the UCSF Health Cancer Genetics and Prevention Program, and it was a delight to have him on the podcast. Let's get started. Welcome to the show, Barry.
Hi, Kate. Happy to be here.
I'm so glad that you are here. So, I know we wanted to talk some about cancer genetics. That's the area that you specialize in. Tell us a little bit more about how you got into cancer genetics.
When I was training, it was one of the required rotations to be a genetic counselor. So I didn't know that I wanted to go into cancer genetics. I know a lot of people have a strong background or have some family reasonings to go into cancer genetics, but it was kind of new to me. But it was part of just the curriculum. But what really drew me to it in training that it was a field of genetics that really touched a lot of people's lives.
Mhm.
And it really had this public health aspect to it that also was another component of my graduate training. It was a common complex disease. There was lots of opportunities to help people understand the disease, to alleviate fear or misunderstandings. And there were both very complex aspects of cancer and very common aspects of cancer that apply to everybody. And there was opportunities for early detection and intervention and cancer risk reduction to really help people mitigate their risk. So there was an actionable component to it, and
Mhm.
that was really exciting that you could really intervene and do something about cancer risk.
And you mentioned that the public health aspect. So you have basically a double master's, right,
Mhm.
in genetic
Yeah,
counseling and public health.
yeah. In a lot of ways, I thought of it more as a way to like not graduate as quickly, and or I couldn't figure out a research project and delay the process. But also, my dual master's was in health behavior and health education at Michigan, so it was really a way to help understand how people thought about thinking about their own health and how people make behavior change. And so understanding what factors go into how people understand what contributes to their health and what factors motivate making modifications to their health, and how we as healthcare practitioners can, sorry to say it, convince people to make changes to their health, was really complementary to my role as a genetic counselor.
And I will get into it some more, but I think it's interesting that you found kind of cancer genetics. Like you said, it sort of encapsulates this genetic molecular type of testing to find out who might be at risk, but then pulls in that public health component of many cancers happen just by random chance. And there's also environmental lifestyle factors that factor into it. So it does sound like it's kind of at a good spot in between the two areas where you can help people understand not only their genetic risk, but also environmental risk as well.
Yeah, I think that's one thing that can be sometimes confusing, is that there's a lot of that like I said, like before, that misunderstanding of where cancer comes from. And in my work, I work with a fairly low income population, a lot of more recent immigrant populations where there's a big understanding of what cancer even is, where
Hmm.
cancer might be taboo, might be something that people don't talk about in the family, where there's a very limited understanding of what cancer even is as an entity. And so dispelling some of those myths about where it comes from, what causes it, so that people can better understand what actions they can take to help lower their risks and or help detect cancers earlier when they're more treatable so that they can live longer lives is a big component towards helping people stay healthy.
Right? Because I think part of it is being able to communicate to the patient or to the family, even about what it is that you're discussing before you get into the nitty-gritty science part, is kind of figuring out their understanding and what they think is happening. Is there a succinct way or a way that you've kind of honed over many, many visits with patients and families that you describe this is what cancer is or how it happens?
So, when I think of cancer, it's really our own cells in our own bodies finding a way to transform or change and grow out of control. And the most common reason why cancers form is simply because of aging. The older we get, the more opportunities our cells have to be exposed to different things that cause those changes, that cause them to do different things. And those different things allow them to grow out of control, to invade other parts of the body, to spread. And those are some of the features of cancers that we know about. And when we think of cancers, they can start in different body parts, and each different cancer is unique to the different body part that it starts in. And so each different type of cancer has its own unique um, features and its unique contributors that cause it. For example, breast cancer, for example, is one of the most common types of cancers. And one of the strongest contributors to breast cancer is actually the hormonal environment of the body. So, thinking of some of the common hormones in the body, like estrogen and progesterone, and the amount of exposure of the body to estrogen and progesterone can either raise or lower an individual's risk to developing breast cancer. Whereas that has nothing to do with a person's risk for, say, skin cancer. And so, depending on what cell type and what body part or what body part, there can be different contributors to why that cancer can develop.
Hmm. So it sounds like there are many different reasons why a cancer may occur. Some may be inherited, but many are not. And when we say environmental causes, we really can mean anything. So it's not just thinking about like a radiation event, like a 3 Mile Island or something like that. It's really even just more subtle, like hormones that our bodies are already making, anyways. And just over time, things can happen or accumulate that could cause the cancer.
Yeah, you're right. I think of the environment as really a number of things. It can be a person's lifestyle, a person's diet. We think of all these things like, oh, that causes cancer. But like when you hear about it in the media, they can be like chemical exposures, they can be radiation, it can be the immediate environment near the cell in a person's body. It's the overall environment that a person body and or those that specific cell that might eventually become a cancer is in.
Right. So not just the person themselves, but the small cellular part of that person.
Exactly. Yeah. In combination with the underlying genetic basis, like you're saying,
Hmm.
of that cell to begin with, does it start with an increased risk of even becoming a cancer?
Right. And so that's what it means to have like a hereditary or a genetic cancer, means that you've already kind of started a little bit of the process towards cancer because there's something that you got from like mom or dad,
Yeah.
basically. Okay. So since there's this genetic part, there's these other parts too that impact it. So the risk for somebody's cancer is not straight across the board. Like there's not necessarily a number that you can give every single person. So how how do you have like a personalized risk to cancer? How does somebody know what their personal risk is for cancer?
I think one of the things that I oftentimes talk about, and one of the things that we have to dispel is that from a baseline standpoint is that nobody has a zero risk of cancer and that everybody has some range of a risk of cancer. But our ability to personalize risk really depends on at what point they are in their life and at what things that they been exposed to. So what in quote unquote environment, as we've been talking about, they've been in, as well as what underlying genetic factors that they were predisposed to or what they were born with. And so there can be some major genetic factors that we may have heard about. So, like inherited conditions that one can do genetic testing for. There can be very small genetic factors that can also contribute to risk. And then that can be used also in combination with some of the lifestyle, environmental factors that can sometimes be calculated in there to help personalize a person's risk.
Mhm. Yeah, because I know, like, when I've been to the doctor, because you mentioned breast cancer as an example, that's probably what they're doing, right, when they're asking, like, if you've had kids, if you've been on, any type of, like, hormone replacement therapy or things like that. So they're trying to figure out exposures most likely to different levels of hormones.
Yeah, a lot of them are really guesses at the end of the day.
Yeah.
They take a bunch of different studies where they say, oh, this one factor in this one study raised this group of people's risk, or they compared this group and they had X amount higher risk than this group, and then they hope that they can combine that into a calculator and multiply it all together, and you get some number out of it. It's not by no means close to perfect, and it's probably by no means even close to even an approximation, but it gets people a little bit closer to a better understanding of where they may be than just saying that they're at average risk or low risk or high risk,
Mhm.
so that hopefully people can make some better decisions about their own health and decide where I want to take my health decisions and what actions do I want to take to reduce my risk or do earlier cancer screening.
And I think we had an episode with Deanna Darns about access, and she talks about how genetics isn't a crystal ball, but it sounds like it's not just genetics, even these estimations, knowing exposures to hormones, or like we said, these overall environmental factors that can tell us some, if somebody might be at slightly more risk than somebody else, but it's not necessarily going to give us, here's your number exactly of your chance to get cancer.
I That's one of the hard parts too, is that a lot of these personalized scores are really comparisons against other people, but yet we really try and force it to make it into a number, that because that's how our minds think, is we want an absolute number to say, like, this is our percentage, but those percentages are really contrived, and we use those numbers to make these sometimes pretty severe decisions about whether or not to do a surgery or whether or not to do a MRI versus a mammogram, a breast MRI versus a mammogram in the healthcare setting. But
Hmm.
a lot of these personalized risk calculators really are just models of comparison. Are you at higher risk or lower risk than this next person? And there's lots of room for error on these models as well, that is oftentimes not accounted for. And there's lots of caveats to the populations that they're actually even applicable to. Oftentimes, the populations that they're studied in are very specific populations, typically European origin, and may not be applicable to the individual that is asking the question.
Hmm. And so these are the types of tests where they're not necessarily looking for one specific genetic change. Like we've mentioned in a couple episodes, things like BRCA or BRCA genetic testing. They're looking for something very specific that's it basically it's either there or it's not. These tests that you're talking about, or risk calculations that you're talking about, they're not a definite yes or no. And they have some caveats and some things that work, but some things that maybe not work. And you're kind of trying to like shoehorn something in because you may be looking at
Yeah.
data that comes from a population that your patient is not from.
Yeah, the name for some of these tests are called polygenic risk scores, and we're starting to see a whole lot more of these. And the general idea behind them is that we talked about this a little bit before. We all have a lot of little small genetic risk factors that can increase or decrease risk for disease, in this case, cancer. And individually, those small genetic risk factors don't amount to a whole lot. If we've just
Hmm.
looked at one, it wouldn't amount to any significant change in our understanding of our health or amount to any significant behavior change in our health. But when we start looking at tens, hundreds, or even thousands of these individual changes, that could amount to a more significant amount of risk that could lead to a significant amount of change in our risk of cancer, for example, that would lead to a clinically actionable or medically actionable change for that a clinician might recommend. The majority of these types of tests are perhaps best recommended under the guise of research at this time.
Mm.
And there is a number of research studies being done across the country, studying the utility of using these polygenic risk scores in the context of different types of cancer screening. They're also being done in the context of other disease states like namely cardiovascular
Hmm.
conditions and many others. But there's also commercial versions of these that have existed as well.
And those are the ones I think I'm probably more familiar with because I used to, when I was seeing patients, right, we would test for something like BRCA. And then some of those patients would end up, especially if they tested negative, may opt to do something like a polygenic risk score. So again, not telling them that there is something inherited, but just saying, okay, based on all these multiple genes and how they all kind of look together, here's what
Yeah.
we're saying your chances. Okay. And then how does family history like play a role in cancer? Because we've talked a little bit about hereditary types of cancers. And from what I understand, hereditary cancer is only a small percent of cancer. Most cancer is not something that runs in a family. But how does family history factor into people's risk for cancer?
I think a family history of cancer is really a proxy for both shared genetics and shared environment, lifestyle, and other factors. Like, obviously, the closer your shared family, the more significant amount of kind of shared genetic material you have with them, shared genetic information. And so a lot of those like little genetic risk factors that could increase or decrease your risk of developing cancer, you might share with a closer family member. And so a family history of a close family member who has a cancer might more significantly impact your risk of developing a cancer. But things like a shared environment might also increase your chance of developing a cancer as well. And that might also mean that you have shared exposures or a shared diet that could also impact your risk of developing cancer. We see this commonly, particularly in certain regions of the world where there may be a certain diet or lifestyle and we see increases of cancer risk in those regions. But when people leave those regions and have a different type of diet, we
Mm,
see a decrease in those types of cancers.
okay.
And so family history can represent that. We also see studies where the family history may independently increase a person's risk of cancer. And so we oftentimes use family history as a marker or sometimes we call it a red flag to indicate whether or not an individual needs to be evaluated for both a hereditary condition. But even after we've evaluated for a hereditary condition and we don't find one, we still use it as a way to assess a person's risk for cancer and modify their cancer screening based off of what their family history is.
So is the recommended, I would say, like a patient coming in, and the recommendation would be let's have you meet with somebody that kind of specializes in this area and see if we need to do testing for a hereditary condition or a hereditary cause. Then, if that's negative, then we can start looking at maybe either polygenic risk scores or just an assessment overall of individual factors to can personalize your risk for cancer.
I think that depends on where that individual is and what I
Hmm.
like both their interest level, their concern and their worry, and how ready they are to really approach that information. I think it's important that the average person who may have some family history of cancer talk to their doctors or ask their family members about, first of all, ask their family members about and clarify what the cancer is in their family and
Hmm.
talk to their doctors about, does this feel like this is a significant family history of cancer? And if that seems to be the case and they feel like that's something that they are concerned about or have questions, speaking to a genetics professional like a genetic counselor or another trained healthcare professional with genetics expertise may
Hmm.
make sense to at least understand what their options are for genetic testing and or better understanding what the available options are for cancer screening and management, even if they choose not to have genetic testing.
Okay, so it's really up to the individual to decide if they want to pursue genetic testing, but like you said, it's talking to somebody who has this expertise, this training about the pros and cons or the ins and outs. How would somebody find someone like yourself who has this expertise and can guide them, or at least help them
Yeah.
understand what's involved?
I fully acknowledge finding a genetic counselor who works in a department that specializes in cancer risk in a tertiary care center in a major city is rare. And having formerly worked in a company that went to very, very remote parts of big states, that it's very difficult for the vast majority of people to find and go to centers like where I currently work.
Hmm.
But there are many individuals. So, in order to find someone like me, I
Hmm.
would recommend going to nsgc.org
Hmm.
and or find a genetic counselor. Searching is it findageneticcounselor.org
Yep.
um,
I think
to
we've
look
put
up
it
a
in
genetic
every show
counselor.
note so far, so I'm getting,
Fantastic.
yeah, I
Um,
have that
but
one.
there's also many other types of genetic professionals like medical geneticists and genetic nurses, et cetera, who also specialize and are experts in cancer genetics. But there's also a number of other types of medical professionals that are both trained and experts in cancer genetics and have a strong interest in cancer risk prevention. And this could be the gynecologist, this could be your primary care doctor in your local community who has a vested interest in taking care of their local community, and they have done the training and the extra education to really learn about cancer risk prevention, and they know how to understand a family history and how to do counseling and genetic testing to manage families. So
Mhm.
ask your doctor, and they may already know this, or they may know somebody in your local community that has that expertise.
Yeah, because I have seen more and more clinics that are their focus is like cancer risk reduction
Mhm.
or prevention, and so they kind of are the experts in like, is somebody at this increased risk? What are the screening options or other types of options? But I think that helps to just say, even chat with your primary care because even if they may not be the person that can do that, they may know who that person is in the community.
Absolutely. Yeah.
Okay, got it. And I guess along those lines, we're talking about, trying to work with a healthcare provider about reducing your risk. How does I mean, is that possible? How does somebody even try to keep from getting cancer?
So, unfortunately, there's no kind of overall thing that dramatically reduces or can prevent cancer overall because everybody's cancer is a unique disease. And every single type of cancer has its own way of developing. So, there's different approaches towards both lowering the risk and or detecting it. So for people who are at average risk, the general strategy is for early detection.
Mhm.
So when we think about some of the most common cancers that people at average risk are at risk for, like breast cancer, lung cancer, colon, prostate, frequent and early screening, like mammography, colonoscopy, PSAs, and are what's encouraged so that early detection and early intervention and treatments can help save lives. But for individuals who may have a hereditary or significantly elevated risk because of family history or other risk factors, that's where we can talk about and where we in cancer genetics and in high risk centers talk more about prevention.
Mhm.
So, for example, individuals who may have a hereditary risk for breast cancer, we offer the options of risk reduction through either medication or surgical removal of the breast tissue to significantly lower breast cancer risk in individuals who may have a significantly increased risk of breast cancer.
Mhm. Right, and we're talking to a few folks, who have had an inherited condition that increases the risk of colon cancer. So I know some of the folks we've talked to have had like a colostomy, like they've had removal, right, of their colon and their intestines,
Yeah.
but that is not necessarily something that you would want to offer or it's available to people with an average risk of colon cancer. It's really for those people that have a significant risk because it is an invasive surgery. It's a big procedure, and you wouldn't
Yeah.
necessarily want to do that if you're at average risk.
Actually, you bring up a good point. I take it back. Colonoscopy is a way to prevent cancer. So colonoscopy actually identifies polyps in the colon before they become a colon cancer. So
Hmm.
polyps are not yet cancer, they're just precancerous growths. And
Okay.
so if you remove them, you are literally preventing colon cancer.
Yeah, that's what
So,
I think you hear that a lot where
yes,
people say colon cancer is a very preventable type of
yes,
cancer, but that's
yep,
because the goal is to use a screening method like a colonoscopy to try to
yeah.
even remove something before it becomes cancer.
Whereas using like a FIT test, the fecal test,
Mhm.
oftentimes only detects a colon cancer that's already there, where you then have to go through the
Okay.
process of treating it. But colonoscopy, which a lot of people shy away from, can actually go through the process of preventing a colon cancer from even forming.
I see. Okay. And so for that, again, that's why it's recommended, I believe, at age 45 now, right? Is that for that's at people at average risk, is that they should
Yeah.
get their first colonoscopy at 45. But that's
Hmm.
probably wise because they're trying to see if they can prevent cancers as people age.
Yep.
Okay. So you talked a little bit about the prevention, the reducing the risks for getting cancer, but like you said, you can't take it down to zero and keep, unfortunately, keep yourself from ever
Yeah.
getting that. Is there ever times where you're working with the patients or the families and you're kind of having to share some of this information and help them navigate either prevention or maybe there are people that have already been diagnosed with cancer. How is that working with patients and families that have had cancer? I mean, what are the challenges in working with some of the families that are dealing with this kind of diagnosis and then also being sent to you to kind of see, can we figure out what caused it? And we may not even be able to figure that out.
Yeah, there's a lot to handle.
Mhm.
Oftentimes, when a family is undergoing a cancer diagnosis, there's a whole new vocabulary that they're learning, and a lot of emotions that they're dealing with, and a whole set of providers and an environment that's all very oftentimes inhospitable, and just trying to juggle information and being forced to make a ton of decisions. And when they see me, I'm oftentimes there to try and help them make just one more decision, um,
Mhm.
and one that their doctor oftentimes really wants them to make. But I'm trying to get them to trying to present the information in a way that is both digestible and at the right time and the right moment for them to feel like they can make an informed decision. And it can be very overwhelming, and it's very humbling to see what patients go through when they're really struggling to think about their health and
Mhm.
where their lives are, and and then also interacting with their family members and trying to really balance their own lives and what their family members are going through at the same time.
Yeah, because sometimes you're trying to talk to not just the patient, but also the person or persons that have accompanied them to the appointment. So trying to explain information to multiple people at the same time.
Oftentimes, I'm the second person or the third person that the patient sees after they've been given the diagnosis of
Mm.
cancer,
Mhm.
and they've barely had time to even digest the information. And
Yeah.
so I may be re-explaining the cancer diagnosis to begin with. And I work with the patient population that where a significant proportion does not use English as their primary language,
Mhm.
and there is a lot that's oftentimes lost in translation. And so I try and use the time that I have with them, because I have a lot more time for my genetic counseling sessions where I have to explain the basics of what is cancer so
Hmm.
that they can make decisions about where they want to take their health, and they can make decisions about genetics and genetic testing.
So there's a lot of potential background or education you have to break down or explain before you even get to the point of, now here's a thing called a genetic test and here's what it does.
That can be the case if
Hmm.
they're ready, or if they want that information, but sometimes it can be too much also.
Yeah.
Yeah.
Yeah. And I think that that's important to note because I know sometimes as a patient, this is happening to you, right? And it's new to you. To the providers that you're seeing, the providers see a lot of patients and families and things that are going through it. But I think that that's important that you called that out, that you're trying to work with them and meet them where they're at. So they might not be able to hear some of this information right now because they're still just adjusting to a diagnosis.
Yeah.
And it's all new for them. Even if you've told people this explanation 5 times already that day, it doesn't matter because it's new for the patient in front of you right then.
Yeah.
Yeah. Thinking about the challenges, I guess the flip side then, what is the rewarding part or what kind of keeps you sustained in working cancer genetics? Why do you continue to work in this space?
I personally care a lot about and advocate for access to care. That's my primary drive, and I particularly care about access to care in underserved populations where English might be a barrier or income might be a barrier.
Mhm.
And so being able to deliver genetic services directly and right in communities, and with efficiency and service delivery models that allow the same level of genetics care as at like at the tertiary care hospital. And so that we can translate the same models across the board is what really drives me, to kind of continue on, and what I find rewarding. Yeah.
Yeah. Well, because I think that's the thing is like genetics sometimes is seen as this specialty area or this area you can only get at certain clinics or sites. And I think that is one of the challenges and what people like yourselves are trying to work on is how do we get this to, like you said, you used to go to very rural areas of states, areas that are underserved or areas where there's barriers to getting the genetic test. And how do you get them accessed or at least to the option of genetic testing, at least get them the genetic services, which may or may not include additional testing. We've covered a lot in the terms of like thinking about cancer care just in general, genetic testing. We've talked some about polygenic risk scores and sort of how can people think about what might be risk factors for cancer. If there's one thing that they walk away remembering, what is the one thing that you want them to remember from this conversation?
If there's one thing I want people to remember and take away, it's, talk to your family. Don't be afraid to ask them about what are the health conditions, particularly what are the cancers that are in the family. Some of the key takeaways are kind of what cancers were in the family and what ages, and take that information to your doctor and ask, is this concerning? Do I need to talk to a genetics professional? And see what they say. Um,
Mhm. Mhm. And
and
then if
then
if they're not sure, you can also, like you said, go to some of those websites and areas and try to find somebody
find a
that,
genetic counselor or a
yeah,
genetics expert.
right, that might know for sure. Okay. Well, I just appreciate you being with us, Barry, and taking the time. So just thanks
Thanks
for
for having me
joining
on.
us. Yeah, it was good to talk to you.
Likewise.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening and join us next time.